Hi, I am Dr. Aida Başkır Martin, and in this video I will talk about the hair anatomy and physiology, one of the accessory structures of the skin. If you would like to hear about my upcoming education videos, make sure to comment, like, and click the subscribe button below to be informed first. I assure you, at the end of this video, you will learn not only about hair anatomy and functions, but many fun facts. I expect from you to not only able to recognize these structures on an anatomical model, but able to draw and label them. Because I believe one of the best ways to learn the anatomy is the drawing and labeling. Hair is a protein, primarily alpha-keratin filament. It originates from the hair follicles and the stem cells on the right above the hair papillae called hair matrix. It originates in the deeper layer of the skin called dermis and extends throughout epidermis to above the skin. About 95% of the total skin area is covered with hair, but not all type of hair is easily visible to eye. Can you guess which part of the body does not have hair? Yes, you might guess it already. We don't have hair on our lips, the palms of the hands, and soles of the feet, labia minora in female, and glans penis of the male. In an average person, the skin has around 5 million hair follicles, and 150,000 of them found on the scalp. When we generally talk about hair in daily life, we refer to the hair on the scalp. What are the functions of the hair? First, protection and filtering. You may understand this function when you think about the special group of hair on your eyelashes, eyebrows, in your nostrils, and entrance of the ear canal. Notice they block the dirt and foreign particles to enter inside your body. Eyebrow blocks the excessive sunlight and sweat to enter your eyes. Secondly, thermoregulation, or another word, regulation of body temperature through insulation and have a role in the goosebumps formation. Acts as a sense organ. That's how we feel the wind blows and feel the bug crawling on your skin. Facial expression, which is the non-verbal communication. Visual identification, and of course, physical and sexual attraction. The layers of the hair are shown in the picture and labeled with the same letter on the list. Mainly have three layers: medulla, cortex, and cuticle. A shown in the medulla, it's soft, flexible inner layer and then formed by soft keratin. The cortex, dense outer layer by hard keratin, compose most of the hair shaft, contains much of the melanin that gives the hair its color. Cuticle, it's the outermost layer of the hair. It's the surface coating by flat overlapping single layer dead cells. And of course, we have a protective layers, inner and outer root sheet that covers those three layers. And they are labeled as D and E. After the bone marrow, hair is the second fastest growing tissue in the body. There are three phases of the hair growth. First, anagen. Anagen or active growing phase is the longest phase and it may take 2 to 7 years. Second phase is a catagen. It's the transition phase and takes 2 to 3 weeks. And lastly, the telogen or resting phase, which is hair follicle stay at rest, no new growth, and it may duration may change from 2 to 4 months. Hair typically grows at the rate of 0.3 millimeter per day during the anagen phase. On average, 50 hairs are lost and replaced per day. Some of the hair on our body is easy to see, like our eyebrows and the hair on our head, arms, and legs. But other hair, like that on our cheek, is almost invisible. Hair that is darker and visible to the human is called terminal hair. Areas of the body that appear to be hairless but have shorter, finer hairs that lack the medulla layer are called vellus hair. During puberty, hormones cause vellus hair replaced by terminal hair. Then, and the male, growing male will have beard growing, right, and mustache and beard, and hair in axilla and pubic area in both gender. Again, vellus hair replaced by terminal hair. Neonates can be born with lanuga hair. They are fine hairs that get shed in utero between 36 and 40 weeks, or sometimes within the first weeks of life, and they are replaced by vellus hair. Clinical application: hair loss or alopecia. Androgenic alopecia, mediated by the presence of the androgen dihydrotestosterone, is the most common form of alopecia in men and women. The pull test is an easy technique for assessing hair loss. Approximately 60 hairs are grasped when you use your three fingers, thumb, index, and middle fingers. Then, if you hold that hairs and gently but firmly pull, it's a negative test. If you have 6 or fewer hairs obtained, indicates normal shedding. But if the positive test, more than 6 hairs obtained, indicates a process of active hair shedding. Let's test your knowledge. Trivia question: do you remember which parts of the body are truly hairless? If you said lip, labia minora, glans penis, and palm and sole, and you were right. Do you remember what is the active phase of the hair growth cycle? If you said anagen phase, you are right. Outside layer which formed by overlapping single dead layer of the hair called cuticle, right? The cuticle. Remember the layers in the middle, we have medulla, then we have cortex, and outermost layer is cuticle. Can you recognize the structure of the hair on the model? Let's draw and label it. That's what I draw for you. It's easy drawing, right? And see, number 1 represent what? If you said hair shaft, yes, I am very happy. In number 2, hair root. Number 3, which is showing the enlarged portion, deep portion, it is hair bulb. Number 4, that blood capillaries and the nerves getting into the hair, we call hair papillae. Right. And 6, can you guess what is 6 represent? It's group of the basal cells. If I say group of the basal cells right above the hair papillae, yes, it is hair matrix. And lastly, 5 is the hair follicle. I hope you liked and enjoyed and learned about hair. And if please feel free to like, comment, and click the subscribe button below if you wanna hear from me more.